In today's video, let's make sure that you're not making these 5 critical mistakes that may be aggravating your bulge disc. I just had a patient who had multiple levels of disc bulge and disc herniations, shocking pain going down the leg, not able to walk, barely able to sleep. Through our program, we were able to safely get her back to everyday life and more. Now this patient is lifting weights, going on hikes, swimming, traveling on a flight with no pain at all. Hi, I'm Dr. Ken, your sports chiropractor and certified athletic trainer. And today we're going to be discussing 5 mistakes that you may be doing that might be aggravating your bulge disc. So let's confirm that you are not doing these 5 things. The first mistake that you may be doing is not finding a comfort relief position. Now, the spine has about 6 main movements. That's gonna be flexion, extension, lateral flexion to the left, lateral flexion to the right, rotation to the left, rotation to the right. But for this comfort relief position, we're going to be only looking at 2 main directions. That's going to be flexion and extension. So bending forward and bending back. Now, one of these positions will give you more relief. Now that is your comfort relief position. It's called a extension bias or a flexion bias. Now, majority of you guys will probably fall into the extension side because that's usually the opposite way of the mechanism of injury. Now, what does that mean? So when you have a bulge disc, that pressure on the spine will come forward, pushing that bulge back. And that's usually how many people will injure their disc. So therefore, by going the opposite way, so into extension, that relieves the pressure and in fact, you feel less pain. Now, whichever direction that you look for or favor, that is going to be your bias. Now that's either going to be a flexion bias, so you feel less pain in flexion, or extension bias. You feel less pain going back into extension. Now, statistically, majority of you guys, again, will fall into this extension, but you have to find this bias or this comfort relief position. That is going to be the first mistake that most people might be doing by not finding your comfort relief position. The second biggest mistake that may be aggravating your bulge disc is too much bed rest. Now, yes, when there's a flare-up, it might be difficult to move, and you may have been told, hey, don't move, just rest in bed. And maybe even in the morning, it's even so difficult to get even out of bed, so you just plan to stay in bed to avoid the pain. Now, some bed rest might be needed. However, too much bed rest can actually aggravate your bulging disc. Now, you may have heard the term motion is lotion. What does that mean? Movement is actually lubricating your discs, your joints. So you want to move, but by being in bed for too long, the discs start to dehydrate because there's no pump or no movement within the spinal discs. Now, back in the day, in the 1980s, there may have been some bad advice because at that time, that's all they knew. Now, you were probably told to rest in bed, don't move, you don't want to aggravate the disc. And it was very much coming from a genuine place to make sure that things don't get worse. However, as research has progressed, motion is very, very important for your discs and your joints. Now, new research has shown that early on movements in a safe manner is actually going to increase the recovery process and help you to get out of pain even faster. Now, why is that? It's because we are now engaging the central nervous system, which is the communication from your brain all the way to our bodies, whether it's hands, feet, core. All these things are activating our muscles early on instead of letting it rest. Now, when we activate certain muscles, certain proprioceptors, we start to actually regain our strength and our confidence back in those areas that might have been injured, decreasing the time of recovery so that you can get back to what you want to do. Now, for an example, let's talk about something unrelated to the spine, but ACL tears. Now, ACL is a ligament in your knee And this post-op, so after the surgery for your ACL, reattaching the ACL, back in the day, they used to put you in a cast, a full-on cast where you're not able to move because that was the protocol in the past. However, with new research, new development of technology, it is now the protocol that after surgery, you go ahead and walk. You want to move the joint as soon as possible. And that's for the same reason with our spine. When you have a bulge disc or an injury, yes, rest is important. You have to get the inflammation down. However, you want to not be in bed for a long period of time because you want to get motion into these areas to help lubricate and to engage the muscles so that you can decrease the recovery time. The third biggest mistake that many of you might be doing is not walking. Now in point 2, we just talked about too much bed rest, so it's very much related. Point 3 is going to be not walking. Now, most of us, when we're in pain, we don't want to do the activities that usually cause pain. Now, that's a natural instinct and is very wise. However, it is, again, motion is lotion. So it is important to move early on as what your body allows. Now, let's talk about this. Walking is one of the most important exercises for bulge discs, lower back pain, sciatica, herniated discs, but in a safe manner. So how do we do this? Let's say we're able to walk 10 steps before the pain starts to increase and makes us feel like we want to just stop altogether. When you have those 10 steps, you walk those 10 steps, pain comes, just stop, hold on to something, relax, breathe. As the pain comes back down, we want to take another 5 steps and then do the same thing. Stop, breathe, 5 steps. Now this is how you get to eventually 30 steps with no pain. We have to start at some level. When you're moving and you're taking those steps, it's very, very important to engage your core around the spine. That is what's going to help protect your spine when you move. Now, when you're moving, you take a few steps, you're engaging the core, you're breathing nicely in through your mouth, out through your nose. Then let's make that to the next 15, 20, 25, 30. Let's walk around the block in the neighborhood. That's how you get out of it. And so I encourage you not to push beyond your limits, but within the limits that are safe to walk as much as you can. The fourth biggest mistake is forcing painful movements or painful exercises. Now we just talked about walking, that could have been painful. However, remember, we're going within the limits. Now this next segment, the fourth biggest mistake, especially comes with trying to stretch out our hamstrings. Now when we stretch out our hamstrings, we tend to come forward and bend in that spinal flexion. What do we talk about? Most people will injure their discs with the flexion movements. So I'm not saying that flexion, you should be scared of doing flexion in general. However, in this time when you have a bulged disc and a herniated disc, it might not be the safest movement. And so when you're trying to stretch out your hamstrings, which you might think is going to benefit the healing process, in fact, it is going to aggravate and cause more inflammation. This is general because hamstring is that spinal flexion. What if you have the spinal flexion bias or the comfort relief position in spinal flexion? Then this might be okay for you. But the majority will fall into the extension bias like we talked about earlier. Therefore, the spinal flexion and the hamstring stretch might not be ideal. Now, there are safer ways to stretch your hamstring in a neutral position. We won't get into that today. We don't want to force any painful movements or directions that our body isn't allowing at the time. So then the question is, which exercises are actually safe? Any exercise that has no increase in pain during the exercise, or no increase in pain after the exercise, and no increase in pain the following day, that I would say is a generally safe exercise to do, and that's actually good because you're getting motion. So how much is too much? And that's a great question. So let me give you an example. You always want to start off with basic movements first, and then gradually increase the intensity and maybe even the frequency of your exercises. Now, this is very different amongst each person. So if you're doing an exercise and you're relatively in the 1 to 3 out of 10 scale of pain, I would say it's actually okay. Make sure that when you stop, the pain of 1 to 3 goes down to a 0 though. That's how you know you're staying within your limits. Now, if that pain does not either 1 go away or 2 increases, you need to back off. And that is how you know you did too much. The fifth and final mistake that you might be doing that may be aggravating your bulge disc is obsessing over MRI results. Now, when you get a bulge disc or a herniated disc, the diagnosis usually comes from an MRI, and maybe the doctor even shows you that, hey, look at this L4, L5, or L5S1, there's a bulge disc or a herniated disc. This is what's causing your pain. Now, it is good to know and to see. However, the most important is how you feel and how you move in the functional movement assessment. Now, the MRI result is going to be very, very important on the initial diagnosis. After that, it's not that important. Now that you got the diagnosis, you have a treatment plan. That's why the initial diagnosis is so important. But if you obsess over this MRI result and think that, oh, I have an L4, L5 herniated disc or a bulge disc, I can't do anything because of my pain, that is a false narrative that you might be speaking into your head. Now, I'm not saying to ignore the initial diagnosis. However, don't obsess over the diagnosis. And here's why. There are asymptomatic and symptomatic people with bulge discs, and you might not even know. There was a study that has been done where they MRI'd asymptomatic people who have no pain in the lower back. They still got an MRI, and most people had bulge discs and herniated discs that they didn't even know about. It didn't affect their lifestyle, it didn't affect their sports, it didn't affect their movements throughout the day, but they all had bulge discs and herniated discs. Now, why is that? Well, the body is way more complex than we can actually fully understand. We're just trying to fill in these little small gaps that we understand through research. Whenever you have pain and this MRI result and the tests, the examination from your doctor matches, then it is most likely coming from that herniated disc or the bulge disc, and it is important. However, with time, it is known that those discs and those bulges start to heal. And even more so, even if you do have the bulge disc, let's say you're able to touch your toes or go and hike, go swim, and you're able to lift weights, then really that bulge disc or that herniated disc, it doesn't even matter anymore because you're able to have functional movement with no limitations or pain. That's the key. So remember, don't obsess over the MRI results. It is important for the initial diagnosis, but after that, the functional movements and assessments are way more important on what you can and can't do for your body. Those are the 5 big mistakes that you might be doing that's aggravating your bulge disc, so please be careful. So let's talk about a question that many people ask. What is a bulge disc and how is it different from a herniated disc? You can tell that the disc bulge is a precursor to a disc herniation. Now let me give you an example that might make more sense. Your car tire, when it's all plump, rolls fine, drives fine, great. But when there is less air in the tire within the PSI that is recommended for your tire, you can notice that when you look down on the tire, it's a little flat. That's most likely considered like a disc bulge. However, if you have a completely flat tire with a hole or tear in the tire itself, that's more so like a disc herniation. There's going to be a tear in the disc, and that's going to leak out the nucleus pulposus, causing you some of that electrifying pain once it touches a nerve. If you've recently been diagnosed by a doctor with a disc bulge or a disc herniation, don't be discouraged. I have many patients who have been through similar pains and discomforts and diagnoses as you, and they are now hiking, they're doing CrossFit, they're lifting weights back to their normal life. Don't let the diagnosis determine what you can and can't do. Now, in this season where you are suffering with pain or discomfort and trying to find a solution, it is important that you find a healthcare professional that can guide you safely back to where you want to be. Don't be discouraged with the initial diagnosis. And I know that day to day, there's little to no progress. But if you look at it from a month-to-month perspective, you can definitely see that you are getting better. If you want to support our channel, please like and subscribe, and make sure to ring the notification bell so you can be updated on the next video. Aloha and take care.